started yet.
Okay. All right, everyone. So today I'm going to talk to you about COVID-19, something I'm sure you're all really excited about since we have not covered it at all in our workplace, right? All right. Right now, as we as Americans and citizens of the world are faced with an unprecedented threat to our way of life and security. Most of you don't need me to tell you about the chaos brought on by the coronavirus pandemic. You're already living it in your workplace, schools, and social circles. Many of us are constantly anxious, wondering if we are overreacting or underreacting, if we're right to be scared, or for some of us, not scared at all. It is a time of mass confusion, and we are all working through it together in order to protect the weak and vulnerable amongst us. In an effort to curb the spread of the virus and allow doctors and researchers time to develop treatments and preventative measures, we are being encouraged, and in some places mandated, to socially distance ourselves, which leads many to wonder, particularly those in otherwise fine physical health, is this the right move? Will social distancing truly have a profound impact on the spread of this virus and save countless lives, or are we unnecessarily panicking and therefore putting undue stress on our economies and social lives? The purpose of this speech is to explain how social distancing works in curtailing disease spread and to discuss its effectiveness in a global pandemic. One argument I hear constantly is that the coronavirus is not that much different from the seasonal flu, and that it has such a small death rate that we should not be so concerned. However, this is a common misconception, and not the entire truth surrounding the coronavirus. According to NPR.org on March 2020, one primary and important difference between the two is the rate of transmission. While both the flu and the coronavirus are transmitted the same way, primarily through droplets expelled from the nose and mouth of a sick person, a typical coronavirus patient will transmit the virus to 2 to 2.5 additional people. This is much more than the typical seasonal flu, which only manages to infect 1.3 others on average. Data from China shows that this is probably due to the incubation period of the virus, with 13% of cases of coronavirus being transmitted to others before symptoms are present. The flu, by contrast, is most contagious after symptoms present themselves. This allows the carrier to recognize that they are sick and thus self-distance before they are able to spread it to others. The coronavirus is not just transmitted more, it is also deadlier. Data from China shows that 20% of those that were diagnosed with COVID-19 had cases severe enough to be hospitalized. That is 10 times higher than the flu, which sends 1 to 2% of its victims to the hospital in a bad season. Not only are more people likely to be hospitalized, but they are also more likely to die there. The flu claims an estimated 300,000 to 650,000 people annually. While more data is still needed to accurately assess the COVID-19 death rate, it is currently estimated to kill at least 10 out of every 1,000 infected, making it 10 times more lethal than the seasonal flu. Social distancing is described by the Johns Hopkins Medical Center as deliberately increasing the physical space between people in order to avoid spreading illness, like today, how you're all 6 feet apart in order to listen to this. Some example of social distancing includes canceling events that are likely to draw crowds, staying at least 6 feet away from others, working from home instead of the office, which none of us have the luxury of doing right now, closing schools or switching to online classes, visiting loved ones by electronic devices instead of in person, and canceling or postponing conferences and large meetings. One of the biggest reasons why social distancing has been encouraged is to flatten the curve of infection. So let's say you're looking at the infection rate on a graph, right? If we didn't practice social distancing measures and everyone was going out and transmitting the disease without any restrictions in place, we would see a large spike in individuals that were admitted to the hospital. This would overwhelm our healthcare system and would lead to unnecessary deaths. However, if you were looking at the chart with social distancing in place, the sharp spike would instead flatten to a longer curve. This would give our healthcare facilities a chance to keep up with the patients and provide adequate supplies, bed, and healthcare providers. Schools and workplaces are closing all around the US. People are understandably worried about the economic impact of this pandemic. Many young, healthy individuals are having a hard time following directions to stay home when they feel fine. However, in a large-scale study by the National Institute of Health, published in the journal Science, they found that 86% of cases in China originally started from an asymptomatic individual carrying the virus. The United States is currently projected to be greatly underreporting due to the lack of tests. Asymptomatic people are not being tested right now unless they were known to have come into contact with the virus. This means that the likelihood of individuals still going about their lives, spreading the disease with no idea that they are doing so, is quite high. Again, looking to China for data on this, they were able to slow the spread of the virus considerably with proper social distancing measures. Through the measures implemented in China, we can see for sure that social distancing does work. And right now, with a vaccine at least 12 to 8 months out, it's the best preventative measure we have. COVID-19 will continue to test us. This virus is not on a timeline and will not just go away and stop killing the vulnerable just because the stocks are crashing. We have to weigh the economic impacts against the human lives that will be lost if we discontinue the social distancing practices. We know social distancing works. We know it's the best tool we have right now to stop the spread,